When the sun starts to go down after a long day, some people might start to get tired. They might grab a nighttime snack, change into their favorite pajamas, and sometimes, when they're really ready to go to bed, they might give a little yawn. Insomnia is the most common sleep disorder in the US, affecting approximately 40 million Americans every year, most commonly women and older adults. People who experience insomnia often experience excessive drowsiness, lack of energy, anxiety, irritability. There's three types of insomnia: transient, which lasts less than 7 days and is often brought on by environmental factors such as a change in time zone or caffeine intake; short term, which lasts between 1 and 3 weeks and is brought on by stress, grief, and pain; and long term, which lasts longer than 3 weeks and is most often brought on by substance abuse, a side effect of a medication, or psychological issues. If you're experiencing long term insomnia, that's where temazepam comes in. Temazepam helps those with insomnia by balancing the chemicals in the brain. Temazepam is a benzodiazepine drug which bonds non-specifically to benzodiazepine receptors. Benzodiazepine receptors regulate many bodily functions, but in the case of insomnia, their most important functions include muscle relaxation and motor coordination. Benzodiazepine works to enhance the effects of gamma-aminobutyric acid or GABA receptors. Temazepam binds to a hole in these receptors and enhances their function. Temazepam, shown in orange here, helps the GABA receptors to function by binding to an inhibitory site on a neuron, which opens a chloride channel and hyperpolarizes the cell and reduces its ability to be excited and to produce a synapse. If the effects of GABA are enhanced, then muscle relaxation is promoted, and people will fall asleep easier. The aryl components on the benzodiazepine drug bind between the alpha and epsilon subunits on the GABA receptor, which is found in the cell membrane. Shown here in a little bit more detail is temazepam in the tunnel of the GABA receptor. In yellow, we have the alpha subunit and the yellow aspect of temazepam interacting with it, and in orange is the epsilon subunit and the temazepam interacting with that. By interacting in this tunnel, the temazepam is able to enhance the effects of the GABA receptor. Here we have a two-dimensional look at what we just looked at in PIMA. We have the receptor in the membrane with the epsilon and the alpha subunits. And here we have the benzodiazepine binding between those subunits at the allosteric site. Since it binds there, it causes chloride ions to have to stay on the outside of the cell, which means that they can't get inside and cause the membrane to become depolarized. This causes hyperpolarization in the membrane, which means that it cannot conduct an action potential. Since the benzodiazepine is between the two subunits and preventing chloride ions from entering the cell, it means that the cell cannot conduct an action potential, therefore cannot contract. If a cell cannot contract, hopefully it causes the same conditions that your body would have to be under in order to fall asleep, thus preventing or even curing insomnia. Because of temazepam's discussed interactions with the GABA receptors, it's effective at promoting muscle relaxation, thus helping to treat insomnia.